Hi, everybody. Welcome to It's Your Case presented by VetCT. My name is Chris Byers, and I'm an American specialist in veterinary emergency and critical care and small animal internal medicine. I'm also one of VetCT's teleconsultants. I'd like to spend a few moments discussing how I approach the initial evaluation of dyspneic asthmatic cats. We're all familiar with the classic clinical signs of respiratory distress: tachypnea, head and neck extension, open mouth breathing, anxiety, nares flaring, abducted elbows, orthopnea, and even paradoxical movement of the chest and abdomen. We also need to recognize that cats often readily mask disease severity, and the only evidence of respiratory distress may be tachypnea and nares flaring. The first step in examining a patient in respiratory emergencies is to perform a primary survey. If the airway is not patent, you have to clear it of obstruction. You have to be prepared to perform an orotracheal intubation. In certain scenarios, you may need to perform an emergency tracheostomy. Now, here's a very important point. One's evaluation of a dyspneic patient begins before you lay hands on the patient. As veterinarians, we need to evaluate a patient's breathing pattern, paying particular attention to respiratory rate, effort, and any noises we may hear. Now, as you watch this video of a 3-year-old neutered male domestic shorthair, I'd like you to do your best to breathe with this patient. I'd like you to engage both your eyes and your body by trying to mimic his breathing pattern. And as you're watching this patient, make some mental notes about whether you feel this patient is putting more effort into breathing in or breathing out. Is he taking reasonable tidal volume breaths, or does he have shallow tachypnea? Asthma is a problem of a cat's lower airway. And as you'll recall, the lower airway is comprised of the intrathoracic trachea, primary and lobar bronchi, and the bronchiolar arborization. Patients with lower airway problems have a characteristic breathing pattern. They have prolonged expiration with normal inspiratory time and effort. Asthmatic patients also have what we call an expiratory grunt. This expiratory grunt is associated with the patient trying to move air that's trapped in the alveoli. And when you look at radiographs of an asthmatic patient, they often have a flattened diaphragm. And that flattened diaphragm, or diaphragmatic flattening, that's evidence of alveolar air trapping. Now, under normal circumstances, the lower airways are narrower in diameter during expiration than during inspiration. And asthmatic cats have hypersensitive airways that produce excessive mucus. This combination of narrower diameter lower airways during expiration with hypersensitivity and partial mucus occlusion requires patients to put some extra effort into expiration to expel air from the alveoli. I've been sharing how evaluating a patient's breathing pattern may be helpful for localizing a patient's dyspnea within the respiratory tree. For example, when one observes a patient with increased expiratory effort and an expiratory grunt with normal inspiratory time and effort, one should logically prioritize lower airway disorders. And certainly in cats, asthma is arguably the most common lower airway disorder. Yet, despite evaluating a patient's breathing pattern, differentiating pulmonary from cardiac causes of dyspnea may still be quite challenging. So here are some additional aspects of a dyspneic patient's history and physical examination that you can take into consideration to help you prioritize your list of differential diagnoses. Number one, a history of coughing. Cats with congestive heart failure rarely cough, but patients with lower airway disorders like asthma frequently have a history of chronic or progressive coughing. Number two, body temperature. Patients with pulmonary causes of dyspnea often have normal or elevated body temperatures, while those with congestive heart failure, for example, typically have low normal temperatures or are presented with hypothermia. So unless a patient is in late decompensatory shock, you should prioritize cardiac causes of dyspnea over pulmonary causes in a dyspneic hypothermic cat. And number three, auscultation. Patients with dyspnea due to cardiac causes often have a murmur or a dysrhythmia, like a gallop rhythm. Patients with pulmonary causes of dyspnea are not expected to have these abnormalities. On behalf of the entire team of teleradiologists and teleconsultants at VetCT, I hope this edition of It's Your Case was both clinically interesting and helpful. Should you have any questions, please do not hesitate to reach out to us. We are here to help. And of course, we hope you'll be on the lookout for our next It's Your Case. Until next time, thank you for what you do, and I hope you have a fabulous day.